in terms of cochlear implants, if there is somebody from the public watching now as well, can you maybe just give an idea the criteria for having a cochlear implant has changed quite a lot over the years, and with funding nowadays and so forth, it's much more accessible than it used to be. Can you maybe give some idea if somebody themselves have a family member or they themselves you know, have heard about a cochlear implant, or they've been advised that it's maybe the next step, but they are still quite anxious about it? What advice can you give them?
Thanks, everyone. That's such a great question, and we get asked it a lot by family members as well who phone in and inquire. So I think that is an area that people are interested in. The first thing to note is that, yes, medical aids in general do cover at least a big portion, if not the entire package of the initial implant. And that's where a lot of parents or hearing impaired prospective cochlear implant users, they think they focus on the initial device and the surgery, and they think if that's covered, then they're great. They're in a good position, which is the first step. But by no means is having a cochlear implant a cheap method or management of hearing impairment. And there is a lot of, especially if it's a child, there's a lot of maintenance that's required. Yes, the kits that they get do cover a lot of spares depending on the kit that they get. So both or all the companies will have various tiers of kits depending on whether the patient is able to pay in over and above the medical aid rate, or they're unable to. So they're able to get a pretty basic but standard kit at the medical aid rate, but they forget then that the follow-up and the rehabilitation and the mapping, and if it's a child, additional school requirements are steep. And so we always encourage our patients that they should have at least 10 to 15,000 Rand saved per year to manage that implant, especially for the first year. As the user becomes less dependent on needing adjustments, so their need for seeing someone becomes less. But you can't predict that at the beginning. You never know how someone's going to really do. We do a whole lot of, yes, the guidelines have changed a lot. And the one important thing that I think audiologists don't realize is that there's no upper limit, age limit on implantation. So if you have a patient that is 90 years old and not able to follow a conversation and has a poor quality of life, but everything else is okay in terms of general health and their ability to withstand a surgery, they are still an implant candidate, a cochlear implant candidate. So that's one important thing. And the minimum limit of age on implantation is probably, with the youngest we've done is about 9 months old, but I think internationally they'll implant a 6-month-old, all depending on their weight and general health. So that's sort of age. And in terms of function, so yes, we look at the pure tone audiogram, but as we all know, that's not the be all and the end all. Generally now they'll look at a word recognition score, sentence recognition score of anything worse than 70%. They'll be an implant candidate, whereas in the past 50% or worse, or 40% or worse was implant candidate. But now because of the number of years and experience that surgeons and audiologists and engineers now have in implantation, they will implant quite comfortably someone that is that's doing worse than 70%. And especially now, since they've brought out electroacoustic stimulation, which is a combination of a hearing aid and an implant. So they put a full implant in, but they may only activate certain electrodes, say, for example, in the high frequencies, and you use an acoustic component for the low frequencies if they've got a precipitous loss. So that combination has also been a game changer in terms of those people who were sitting on the borderline, kind of doing well with hearing aids, but not really coping in noise. And so that's also been a big game changer in terms of what we can offer patients.
That's really good and really promising, I think, also for the future of hearing healthcare.